I'm Mary Baker. I'm the immediate past president of the European Brain Council, which is an interesting organisation. It's made up of all the people in the brain space, so neurologists, psychiatrists, neurosurgeons, neuroscientists, neuropsychopharmacologists, patient groups for neurology, patient groups for mental illness, and the pharmaceutical industry who work in that space as well. The European Brain Council's mission is to try to help all our very talented and specialised members who are excellent in their own situation and knowledge to understand the policy direction of the Commission. I've been very much involved with the patient associations. I was the chief executive of Parkinson's Disease United Kingdom, and then we brought all of that together for the European Parkinson's Disease Association. So bringing again all the diseases in the brain space of neurology together. And that's really good because actually the concerns of the patients, whatever the disease, are very similar. A better understanding of the disease and its disease process, wanting to be more involved and understanding the clinical trials, what's important to them, and above all to campaign alongside the doctors for better standards, better things that can happen in the management of an illness, and to provide help and information for the patients and their families. Patient groups are desperate to be involved in clinical trials, but I have to tell you the evidence is interesting, and this was carried out by the Dutch, that very few patient organisations are involved in clinical trials, which is very surprising because they're really eager, they want to make a difference. I think the job to involve the patients more in this, where they could truly be useful, comes from the regulatory and from the pharmaceutical industry themselves. So we have been working really hard to understand what matters to the patients. So for Parkinson's disease, which I know a little bit more about, so I'll give you that example, is that it's not just about safety and enhancement of length of stride and arm swing, which is what is being measured at the moment. What is important to those patients is the feeling of depression that they have with the illness. That's 41% have that feeling. And then the problems of sleep. It's difficult to get to sleep. And then if you do get to sleep, you wake up and it's difficult to get back to sleep. So sleep is important. Pain is important. Bowels, bladders, sexual dysfunction. That's what truly matters to the patients. Look at their quality of life. The patients, I think, of most diseases are concerned about privacy. And I think that's very understandable. My worry is that if we don't achieve this trust between the patients and the gathering of the data, we're going to miss a tremendous opportunity. So it's essential with the arrival of big data that we help society to trust and to be a valued partner in going forward. This is a real opportunity to collect real-world data. And we should not miss this opportunity. Well, I really sincerely welcome the European Institute for Innovation through Health Data. I think it's very much needed, but again, we'll have to build the real trust between the Institute and the people prepared to give their information. But I think as soon as they start to get results, publish them, get good feedback to the patients will come forward more and more as the trust builds. Involvement of the patient organisations is going to be crucial. So frankly, what I'd like to see is that the Institute involves the patients, perhaps even has them on the board, or certainly has patient groups that can report to the board, and equally that the patient groups will ask the Institute to present at their AGMs.